In this video, I will show you how to quickly relieve lumbar spinal stenosis pain. Keep watching. Lumbar spinal stenosis is a serious and debilitating condition that can cause chronic low back pain, sciatica-like leg pain, including numbness and tingling in the legs, and significantly limited mobility and flexibility. Lumbar spinal stenosis can make everyday life harder by causing constant back pain, affecting your mood, your mental health, and making it difficult to work and to socialize. Hi there, I'm Dr. John Zielonka, a neurofunctional chiropractor in Ottawa, Ontario, Canada, and past director of rehabilitation at the Sports Science Center. If you're dealing with lower back pain or leg pain because of lumbar spinal stenosis, you don't want to miss this video. I'm going to show you 5 proven exercises that are going to target the lower back. They will work on relieving lower back pain and leg pain from lumbar spinal stenosis. These exercises are safe and effective and can be done at home without any exercise equipment. You will find these moves may help relieve lower back pain, low back stiffness, and leg pain within minutes. So let's dive in. So exercise number 1, a very straightforward exercise for lumbar spinal stenosis is what we call the knee to chest exercise. So now think of what we're doing in lumbar spinal stenosis is you've got a canal that is narrowing. That's what stenosis means. We want to be able to open that canal. So any type of exercise that's going to involve flexion is going to be a good thing. So in this particular case, very, very simple. We're just simply going to take one knee and we're going to start to pull it towards the chest. We want to get to the point where you feel a good stretch. That old adage, no pain, no gain, does not, never has, never will apply to stretching. There should be a good stretch. People ask, how long do I hold this stretch for? It depends. Often you'll be told 5 seconds, 10 seconds, 20 seconds. In this case, we're only going to hold it for about 10 just for demonstration purposes. And then we're going to switch to the next leg. Okay? But what you really want to is you don't have to count. You want to hold the stretch long enough till you actually feel a good stretch. And then you want to hold it long enough so that you actually feel the stretch ease up. If you're doing so, you're then finally accomplishing what you're trying to accomplish. We'll go back to the next knee again. So you would typically go through, we'll do the left knee again. We typically do this 5 times on each side, each time holding it for at least 10 seconds, but ideally, again, don't count. Go to the point where you feel the stretch ease up. You want to accomplish exactly what we're trying to do. Same thing again on the right knee. As I said, we're going to go through 5 sets of these. You know, think about the person you see in the gym who's been going there for 5 years and 5 years later is no better, is no different. What you want is you don't just want to go through the motions. You want to feel a stretch. You're actually stretching the back of the hamstring, the glute, the lower back. You're actually opening up the canal. That's going to take pressure off the lumbar spinal stenosis. When you've done that, your 5 sets, then you're going to modify this. And then on the next one, we're actually going to do the double knee to chest. So you're going to bring both knees at the same time. And again, go to the point where you feel a nice stretch in there. Don't forget to breathe. Okay? For whatever reason, a lot of people forget to breathe when they're doing exercise. Your body needs oxygen. Okay? So we're going to try that one more time. And again, ideally, you want to do this a good, at least 5 reps on each side, 5 reps to the front. This is going to be great for opening up that spinal canal and start to give you some instant relief. Exercise number 2 is what we call the sit flex. So here's one of the nice things about these exercises as well. For a lot of people who are suffering with lumbar spinal stenosis, it's even tough to get down on the floor, certainly to get back up from that as well. So we're trying to give you as many exercises as we can where you don't have to do that. Again, you don't just want to go through the motions. Think of what's actually happening during this particular exercise. So in this one, in the sit flex, is you'll be sitting on the edge of the chair. Be careful that you're back enough on the chair. We don't want you being that one person who actually falls off the chair, but you're going to sit more on the edge of the chair, and then all you're simply going to do is we want to actually, again, stretch out the lower back. We want to open up the spinal canal. That's going to be beneficial for lumbar spinal stenosis. You're going to find that most exercises you do not want to go into extension where you go back. That's just going to put more pressure. And especially depending on what's caused the spinal stenosis. As we talked about in the past video, often that's coming from osteoarthritis, but it can also come from spondylolisthesis, it can also come from disc herniations and so forth. In most cases, flexing forward is going to be beneficial. So here, you're simply actually going to bend forward, You're going to actually grab the outside of the ankles and you're going to pull the back forward. And again, you're going to go to the point where you get a good stretch. You're going to want to hold this for a good 10, 20 seconds, possibly more. Again, hold it to the point where you feel a good stretch, and then that stretch actually eases up. Then you'll come back up again. Okay? You'll take a second to rest, and then again, you're going to come forward again. And if you want to get an even better stretch, you can actually start to pull on your legs with the hands to actually pull more of a stretch. But again, to the point where you feel a good stretch. And again, it's not about pain. If you ever feel any numbness or tingling or pins and needles, if you ever feel any sharp pain, then back off that immediately. And that's one of the key things is, although we're trying to give you the 5 safest exercises for lumbar spinal stenosis, they're depending on what's causing your lumbar spinal stenosis. There may be the rare case where you need to back off on these exercises as well. So again, remember to breathe, so nice deep breaths in and out as you go through this. And you want to do this at least a good five times. Again, come back up. And what we're going to find is this can sometimes give you immediate relief to the lumbar spinal stenosis. We do this one last time. We come down, we feel a good stretch throughout the entire back. Okay? You feel it into the buttocks. You'll actually, what you're doing again is you're actually trying to open up the canal and take pressure off the back. Okay, and also get a good stretch in all that musculature at the same time. Exercise number 3 for lumbar spinal stenosis is what we call nerve flossing. Now, I know that sounds like a bit of a strange term. You often think of teeth, but that's really what you're doing, almost similar to flossing teeth. We want to floss that nerve because, again, in the lumbar spinal stenosis, you narrow that canal. That nerve actually then becomes almost stuck, or certainly doesn't move the way it should be. There's not a lot of room for that nerve at all. Once you affect that nerve, wherever that nerve goes to will be affected. So that can start to affect anything from low back pain to pain down the leg, to the numbness, the tingling, the pins and needles. Remember, these nerves also go to the bowel, the bladder, the reproductive organs, so all those things can be affected. And so what we're essentially doing is we're essentially flossing the nerve. We literally want to try and get some movement back and forth in the nerve. So what we do in this case is we're actually going to put a band around the foot, and then what you're going to do is you're going to bring the leg up, and then when the leg comes up, what you're doing now is you're now beginning to start to stretch this whole area. So you're getting stretching to the calf, to the back of the hamstrings, to the glute, to the lower back as well. But now the floss the nerve, you're going to see you're actually going to get movement in the foot where the toes are going to come towards the patient, and that's putting a stretch through there. And then back, we're actually flossing that nerve through that canal. And in doing so, you're going to get better movement coming through there. You're going to start to take some of that pressure off that area. Again, be careful with this. Okay? It's something where, you know, go to your tolerance. Go to the point where you feel a stretch. For a lot of people, sometimes even getting the leg up this high is going to be difficult to do. And also, you can use a band. Ideally, make sure there's not too much give in the band, because you actually do want some resistance to assist in making that movement of flexing the foot back and forth like that as well. Then after doing that about 10 times or so, you're going to switch legs. Now watch here, when we switch the legs in this particular case, right, you're going to find this leg actually has already a couple of issues, and this is often going to be the case if you're suffering with lumbar spinal stenosis. So you'll actually see the movement is not going to be as good as we would otherwise see. Okay? But again, we want to start moving the foot backwards and forwards, okay, flexing and extending it. And in doing so, we're literally starting to floss that nerve through that canal. Again, you're going to want to try and do this a good 5 to 10 times at least. Okay? You want to feel that stretch through the back of the leg, through the calf, through the hamstring, into the glute, into the lower back. But essentially, the whole idea is that we're flossing that nerve the same way that you would actually floss teeth as well. Okay, and exercise number 4 for lumbar spinal stenosis, we're going to do a very neat exercise. It's what's called the walking pelvic tilt. So you'll hear the term pelvic tilt quite often. And this obviously is the pelvis down here. And the pelvis sits in here. We've got the pelvis obviously down in here. And what we want to do is a pelvic tilt. Often people confuse this because you can actually tilt the pelvis what I call posterior, which is backwards. You can tilt it forward, which is an anterior pelvic tilt. It depends, for reference point, are you talking about the top or are you talking about the bottom? So I always refer to the top. So what we're really doing is what we call a posterior pelvic tilt. Because if I do that, again, I'm opening up that canal. So this is the benefit of this. The benefit of this particular exercise is twofold. Number one, we're going to open up that canal, but then we're also going to teach you how you should be walking in that position. So we're basically retraining the body to be like this all the time, because people with lumbar spinal stenosis, they have significant difficulty to walk and to just even stand. And for a lot of them, they've just gotten in that position where that's always jammed in that forward position. Okay? So what we want to do here is first, we're going to start with a posterior pelvic tilt. This is going to come back, and then just take a step back so you get a little more center here. Okay? And now what we're going to do in this position is we're just going to do stationary walking. So we're going to start one leg up, then the next leg up, but all the time maintaining that posterior pelvic tilt. And notice we're also going to start using the arms and the hands here as well, because that's how you should be walking. We're retraining the body. What happens when people have a lot of these conditions is they fall into what we call faulty movement patterns. And so the body basically is trying to make the best of a bad situation. It's accommodating. If we don't untrain your body how to come back to normal, you're going to have a difficult time. So when we're doing this, remember, we're making sure that the pelvic is back in that posterior pelvic tilt, and then we're actually making sure that we continue to stabilize the body. Again, this is something you can do for a good 60 seconds at least, if not longer. Okay? And it's also a good way to actually just improve overall walking. We're also building the musculature, because for a lot of people, when they have the lumbar spinal stenosis, they really are not getting very much activity at all. It's estimated only about 4% of people with lumbar spinal stenosis get the level of activity they're supposed to get. And that just spirals downward. If you're not able to do these things, then the weaker you become, then surprise, surprise, the less activity you're going to do, and then the less activity, the weaker you're going to become. And that brings us to exercise number 5, what we call the sit-stand. So again, most people, when they think of exercises, they're just thinking stretching, or they're thinking something high impact. If you're suffering with lumbar spinal stenosis, you're certainly not doing anything high impact. You'd just like to be able to walk again. You'd like to bring some function back. One of the issues is lumbar spinal stenosis doesn't just cause the pain and the numbness and the tingling, and can possibly affect the bowel and the bladder and the reproductive organs. But it's terrible for mental health as well, because you'll find if you can't get anywhere, if you can't stand, if you can't walk, then there's a lot less socialization that's going on. You're not seeing your friends, you're not going to work, you're not doing the things that you need to do. So in this particular exercise, what we want to do is, not only does this actually help with balance, it actually helps open that canal, but it's also going to start to strengthen those muscles that we need strengthened, that are used again, in walking and standing. So in a sit-stand, you're on the front edge of the chair, and all you're going to do is you're going to go into a slightly flexed position, okay? Not terribly forward, but slightly flexed. You don't want to be in an extension, and then all you're going to do is you're going to stand up. Okay? And so from this position, you simply stand up. That's engaging the glutes, that's engaging the abs, that's engaging the whole core, and then you come back down again. Okay? Now, you're going to repeat this a good 10 times, and when you do this again, focus on what you're doing. Okay? Like, engage the abdomen, engage the glutes, focus on coming straight up. If you find it's really difficult on this one here, if it's something where the spinal stenosis is severe, you're going to use the armrests to come up. Okay? And again, just nicely, gently push yourself back up. We're now starting to strengthen all these muscles that will atrophy. So atrophy, think about this from a good analogy would be a blood vessel point of view. Is, if you want to kill an organ, you cut the blood supply. Well, if you want to kill a muscle, you cut the nerve supply. You also kill the organ by cutting the nerve supply as well. We want to start engaging these muscles again. So very simple. All you're doing is standing up, and this is very much what we call a functional exercise, because guess what? This is one of the difficult things people with lumbar spinal stenosis, can't really do, is just something as simple as getting to that standing position. We'll get better at that by actually practicing that. And back down one more time. Now I want to hear from you. Which exercise did you find most relieving? Was it exercise number 2, the sit flex, that really stretched out the entire back and helped to open the spinal canal? Was it exercise number 4, the walking pelvic tilt, that taught you how to focus on the pelvis and proper position while walking, something difficult for people with spinal stenosis, just to walk and to stand? Please leave a comment below and let me know. If you found value in these exercises, please do subscribe to my channel now. Also, like and share the video because it helps support my channel, and more importantly, you can help others. Now, if you want to see how to treat lumbar spinal stenosis with a revolutionary non-surgical method, watch the video up here in the corner, please. Watch this video next.